Okay, what's up? Um, this is Shepard. I'll give you a little demo here. Shepard is starting out as an AI scribe, but it does a lot more than just an AI scribe. So it has um, a doctor or provider side essentially, and then also a patient side. So we'll go over the doctor side first and show you what Shepard can do. So when you first log in, it's very simple. It's basically like, let's record this encounter or visit, or you can record, obviously, a dictation if you want. It has a menu right up here, and we'll go through this menu in a sec, but let me just show you how this works because it's not just a typical dictation. We have some really robust and awesome features after the note is done. So let me show you that, and maybe I'll speed this up. So a 21-year-old male presents to the ER with abdominal pain, fevers, chills, nausea, vomiting. His pain is periumbilical, moved to the right lower quadrant over the last 3 days. He has some anorexia, no dysuria, hematuria, and his past medical and surgical history is negative. He has no social history. His review systems are negative except for what's in the HPI. By the way, we have a live interpreter here, so if you need that, you can just click here. You can say English, Spanish, and then now you have a live interpretation of the visit. So if you're sitting with your patient and they're, obviously Spanish, then you can just show them this, and then after you speak, it just comes up and shows them. So physical exam shows a right lower quadrant tenderness with some guarding but no rebound. He has a positive Robsing sign. There's no labs or radiologic examinations. Assessment plan is 21-year-old male with possible acute appendicitis. We'll make him NPO, give him IV fluids, antibiotics, CBC, CMP, UA, and a CT, abdomen pelvis with IV contrast. So we'll go back to the session and we'll stop the recording, and then we'll hit generate note. We might change this so you just stop recording, it generates note automatically, but we'll see about that. So basically what's going on is this is taking these audio packets and sending them to OpenAI. OpenAI, as obviously we have prompted OpenAI to write the notes how we want them. So they're modifiable, but this is sort of how we like it so far. So now this is a preview of your note. This is not the actual note, and you're going to see what happens in a second. What happens to your note? It's got a lot more things in it than just a note here. So obviously, right at the top, it says safety considerations. Right lower quadrant abdominal pain with fever and guarding. Consider ruling out risk of appendiceal perforation and peritonitis. Right, fever and chills accompanied by abdominal pain. Consider ruling out possible involving intra-abdominal infection or sepsis. So now we go down here and we check out chief complaint, our HPI. All of these is filled in for you. Review systems. Now you saw that I didn't say really much about the review systems, but it filled in everything. It only filled in positive for abdominal pain, nausea, vomiting. Denies diarrhea, constipation, and blood. So, okay, so it fills in all this stuff. If you don't say, obviously you can edit any of this here, whatever you want. So if you need to edit it, you can. Now I'm gonna these terms here are all highlighted. I'm gonna go and tell you exactly what that means in a second. So here's our physical exam. I only did the abdomen. It fills out a good physical exam for you. Obviously, you need to do your own physical exam. Make sure this is all correct, but it fills a robust physical exam out. Labs, we said there was no labs or imaging. And then this is, you saw how kind of short I gave this assessment and plan. And then this is it gives you a big differential, right? I didn't do a differential, it gave me a differential. Medical necessity, appropriate to obtain labs and assess for infection, electrolyte, blah, blah, blah. Okay. And then medical decision-making, complexity, moderate due to the need for diagnostic workup and management. And then plan. So here's your plan. I don't think I said all of these, but something like that. So it gives you a robust plan. So let me go back up to here and see all these terms here. Now, if you're like a student and you're not sure what lymphadenopathy is, you can click here and it does a deep research on that medical term. Now, this is any medical term essentially that's highlighted. This is going to pull up. This is more for students. So they're going to read about lymphadenopathy. Great. Here's a definition. Here's some clinical pearls, differential considerations, red flags with lymphadenopathy. Here's a video you can watch. Here's some Cochrane systematic reviews you can check out, active clinical trials, PubMed citations about that, right? And then you can create flashcards and take a quiz here. So, and let me see, I'll show you that says ACS surgery boards. The reason it says that is because when I created my account, I put in that I am a general surgeon and my next exam is the general surgery board. So if you are a medical student, first year medical student, you're studying for step 1, then you put in you're studying for step 1. And every year it'll update that and it'll ask you, do you want to change your exam? If you are a first year resident intern, you're studying for step 3, then all the flashcards and all the quizzes will be geared towards step 3. So it's for everybody, nurses, RT, like it doesn't matter who you are. When you first create your account, you tell the system who you are, what you're studying for, and it gears all the flashcards and quizzes and everything, learning essentially to that. So this is the teach portion of Shepard. So I kind of break it into 3. There's teaching, assisting, and protecting, and you're going to see what that means in a second. So here's the differential diagnoses, right? Now we had some differentials here that it gave us, but if you want to add, if you maybe see one of these and they are really sort of more appropriate for this patient, you can just add this and it goes right in your note. Right now you have you've added differential for Meckel's diverticulitis, right? Consider pelvic inflammatory disease. This was a male, so I'm not going to do that. Okay, and now we move on to, sorry, this is sort of the assist portion. So these differential assist, and then plan suggestions. Okay, consider ultrasound of the right lower quadrant as initial imaging modality if CT is contraindicated. So you could add that and say, oh, CT is actually contraindicated. This patient has a high, GFR or low GFR or whatever. And then, so you can add that, add pain management with appropriate analgesics. Okay, none of these are like super arranged surgical consult. Okay, maybe I'm in the ER and I forgot. I'm going to put that, but I just totally forgot to say that during my note. So I can add that into my note. Of course, when I am done with the note and I review everything, I confirm that this is my note. I really, this is accurate and this is my note. So these are some more of the assistance portion of Shepard. So this is what's going on. Here's some critical actions. Oh yeah, I forgot to mention he's NPO. I'll add that. Workup checklist. Okay. CBC with diff. Oh, I forgot to say diff. Man, I'll just add that. Okay, right. So ceftriaxone, metronidazole, whatever. So here's the disposition. I can add that to my note. And then here's just like some things some guidance. Let's put it that way, right? This is all guidance. You are the doctor. You're eventually, or provider, you're eventually making the decisions. But Shepard's just like, okay, let's just make sure that we're doing everything we should be doing for this patient. Just a little like second set of eyes. Okay, so now we move on to the protect portion. And this, I think, I wish I would have had this when I was a med student, a resident, attending, forever. So this is the medical legal section of Shepard's note. And this is going to say, listen, acute appendicitis, there's only a few ways that you get sued from patients from acute appendicitis. And let's talk about which portions of this encounter are the problem portions and what you should do about it to make sure, number 1, you're taking care of the patient correctly. Number 2, you're covering your butt. And number 3, you're documenting the correct medical legal jargon, I don't say jargon, but medical legal note, right? So focused physical exam, it's just giving you like tips to help you stay safe legally. And also, right, these are also helping the patient stay safe because we're doing everything we're supposed to be doing. Okay, plan, protective phrases. I kind of like this. This is kind of things that you should be doing with this patient. This is the protective phrases. Clinical presentation and exam findings are consistent with acute appendicitis requiring urgent evaluation and management. Okay. Patient and family were informed about the potential need for surgical intervention and signs of clinical worsening. So if the patient and the family are not informed about that and the patient goes to surgery and they say, oh my God, you didn't tell me that. Or you're like, yeah, I did, but you didn't document it. Guess what? It doesn't happen, right? The famous attorney saying, if you didn't document it, it didn't happen, which is ridiculous. But anyway, so you can add those to your note. Here are some common pitfalls in this encounter. Some billing tips if you are doing billing, which if you guys are interns or residents, you're probably not doing that, hopefully. And then some handoff essentials. Make sure that you are handing these off appropriate, or this information appropriately to whoever is taking care of the patient. And then you can generate patient education. Say this is a patient that's going to be going home from the ER, or you saw them in observation or whatever, and you're going to send them home, and you want some patient education. Like a lot of obviously hospitals have their own patient education, but this is also directed towards exactly your note. So understanding your diagnosis, usually we have some pictures here, we'll fix that. Symptoms, causes, treatment, self-care at home, when to seek medical help, prevention, some videos they can watch on it, right? Mine should be in here, but it's not, I guess. But anyway, and you can just edit, copy, text, email, turn it into a PDF, whatever you want, right? All done. Okay, cool. So that's like the main sort of portion of the note. Let me go into the rest of this here. Now, let me see, let me think. I'm gonna go to the demo mode. So it has some information here. So when we come up here now, if you are, we integrate into Epic, so your hospital has to like approve it and all this stuff. But once you're integrated into your hospital, you can you can tap into Epic or whatever. You can tap into Epic, and then you'll have your patient list. So you can go to My Patients. Like here's your patients, and then so here. I don't know why I did that. This demo mode kind of does some funny stuff sometimes. So, so here you have emergency, ICU, telemetry, med surge, OBS, right? And you can go in here and say, okay, well, he's moved to, we're going to move him to the ICU, right? So then he should move. Oh, did he move? Didn't move. We'll fix that. This might be the demo mode. But anyway, so you have your patients here. You can add a patient manually, but you should be able to pull all of your patients from your Epic as well. Oops, sorry, I didn't want to do that. My patients, right? So we'll go into this guy. So here's his notes. Here's the notes that has been made through Shepard. Now, these notes also can be posted to Epic as long as you're hooked up and everything. Here's the Epic notes. This is obviously demo that shows like you're already hooked up to Epic. And then so you can just go in here and look and read these notes just like you're reading your notes on a computer. Active problems, recent vitals, medications, allergies, recent labs, all that. What else did I want to show? Team. So now we just added this with some help from one of the residents, the ENT residents. So this is pretty awesome. So this is a task list, and you can see the pending tasks, all tasks. These are all done. These are done. And you can make tasks by day, daily or ongoing, like today, what am I doing? Ongoing, patients, or you can group them by patient category and priority. I don't have any text in here. I don't know why, but yeah, we did that. Let me see. What did I want? Oh, no. So, no, let's see. Go back here. So when I come down here, this is actually cool because you can generate a handoff based on all these patients, and Shepard will generate a pretty robust and complete handoff sheet so to make sure you don't miss anything, which I know I wish I had that as well. You can start rounds. So when you're actually on rounds, you can pull up the patient's info right here, and you can add things to it. Be like, oh, okay, um, I need to, you know, I needed to get a CT scan pelvis on this guy today, and I'm going to add it to imaging, and I'm going to add task, and now you have a task on that, right? So his full card, where here's his summary, what's going on, his vitals, labs, drains, ongoing tasks, and today's tasks, family meeting. You can add tasks as well here. Team actions, what are we going to do? Whoops, I'm going to show you that, but just in a second. And you can add photos and video for the team. And this, remember, this is all HIPAA compliant. So all the stuff that you have on WhatsApp that's not HIPAA compliant, you can use this now. And so here's a recent activity that's going on, and discuss this patient. So now you have a patient thread with all your team members in here, and you can talk to each other. That's all HIPAA compliant. And then you also have an overall team chat with all the team members, and you're just discussing like whatever's going on. It doesn't have to be a specific patient. This is a specific patient, though. You can go to each one of these patients and talk about that specific patient, so the team knows what's going on, right? This is, I think, is super awesome. And you can also do voice notes. So if you want to do a voice note for this, that'll post in his chart as well. So super cool. Handoff. This is another handoff system. This is like if you maybe are an ER resident or doc, and you have seen 25 patients today. So it'll pull up every single encounter that you've had with Shepard, and you'll just say new sign out, and you'll create, it'll take all, actually, so you'll say, I was on a shift for 12 hours, and I want to create a sign out, and then it'll select, you can select all the patients, and it'll do a sign out for you. Pretty cool. Encounters, this is just all the encounters that you've had with Shepard, like every single note that you've made. So you can go and look at those in chronological order. We do have a note builder because I know a lot of people have templates or want to use templates. So you can just go here and say central line placement, generate a procedure note. And we actually don't have it hooked up to the specific patient yet right now, but we'll do that. It's not that big of a deal. So you have all these different notes that you can pull and just post right to the patient's chart: orthopedic, airway, GI, right? All structured notes, clinical notes, discharge, mental health, nursing and handoff, surgical, preoperative, perioperative, and administration and legal. And Shepard is also for like nurses, respiratory therapists, mental health professionals, all that stuff too. So we have all those. If you want to upload your own templates, you can do that right there. Copy paste, put your own template in. This is how you connect to Epic, and we're working on a couple other EHRs as well. Education, I forget. Oh, this is for like if you want to do the flashcards and stuff. There's Pimp Simulator, daily vignettes, and sometimes I think we have audio learning too. So pretty cool. And you can do study streaks, and keep track of everything that you're doing. Okay, so that is, I think, mostly Shepard. So like also when you're creating an account, you're going to put this, but you're attending or you're PGY3 or whatever it is, right? Your credentials, your specialty, that helps Shepard make the notes. If you put your specialty in there, so that way it's more appropriate for you. And then your current exams right here, so you can pick any of these exams there. Cool. So we're going to go to now wrong one. Clinical, that's how you manage your teams. We're going to go to the patient mode. So now this is a patient, right, that has Shepard, and they're like, I want to record my doctor visit. I want to record my encounter. I want to record the ER visit for my husband, whatever it is. And so Shepard functions the same way, that those patients can just tap record the visit, right? And then Shepard will make a plain English, translation of what the encounter was to something that the patient can understand. Okay, and well, I'm going to show you that in a second. There's a couple things down here. They can just ask whatever questions, and this is sort of, just if they have a question about their last visit, something pops up, whatever. But this prepare for visit, I think, is really cool because they can just type in here, I'm going to see the doctor for knee pain, and I want to get some questions. I want to know some questions um, that I should be asking um, in the visit, because a lot of patients I know go in, they get all this new information. They're like, I should have asked these questions. I didn't know what to ask. It's all new. It's medical jargon, which I don't understand. And so Shepard will produce some questions that they can ask. So here's a bunch of questions. They can say start recording, and then they can record and have the questions right there. Pretty cool. Okay. So once they record the visit, what happens is they will go into these visits here. And this is what it looks like. So very different note for the patient, but geared towards the patient. So what happened during your visit? Like, it's not like your diagnosis, like what happened, what your doctor found, right? Your plan going forward. Because people are like, okay, I got all that stuff. Like, what do I do now? Things to watch out for, right? Medical terms explained. So if they heard some medical terms during that visit, they're not sure what that means. They get a little explanation here, right? And then questions for your next visit, or they could do this like during the visit as well. They produces a note, and then it'll go right here. And then the share. So now they can share with their loved ones, with their family, with their friends, with the wife, because the wife is probably always angry that the husband doesn't know what's going on, right? So now they have all complete. They have a complete record of all of their visits, and they can go back anytime and check these out. And these are all geared towards the patient and not the doctor, because patients get their visit notes or their x-rays and stuff. What do? They call me, my friends, and they're like, hey, can you read this x-ray? Can you read this CAT scan? What does this MRI mean? So to that point, Shepard also, I gotta put the demo on. Is that correct? Yeah. Okay, so once the patient is connected to their MyChart, and we'll have other EHRs as well, then they can pull all of their notes, all of their x-rays, all of their labs, right? Their medications, all those things in Epic, and get a plain English explanation of their doctor visit, of their x-ray, of their MRI, of their CT scan. So now you can say, here's a clinical note, and then I want a simple, standard, or detailed explanation, and explain this to me. And then Shepard reads the note and then gives them a detail, gives them an explanation of that note, of that x-ray, of that CAT scan, of the labs, right? And here it is, Shepard's explanation. Hello, summary of your annual physical exam, blah, 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 what this means, right? Here's all the issues, what this means for you, next steps, all that stuff. Remember, if you have any questions or concerns, report about your health. Your doctor is the best person to talk to. Okay. They can do a detailed one, whatever they want. So they can do this with any of, we can do the labs, we can do the x-rays, conditions, medications, right? All that stuff. So pretty cool. Vaccinations, procedures, vital signs, whatever, anything they want. So that, I think, is pretty awesome. Now, these problems here are listed automatically from just the AI listening. So it'll post all of the problems. They can adjust them if they want, or add them. Here's all their visits. Here's all their medications. This is also added from AI. The patients don't have to add them. They can add them. And then action items is like, oh, your doctor said he wants you to get some labs drawn. Okay, well, this will be in here. So they can come in here, check box like, okay, monitor my symptoms daily, whatever. Follow-up post-op care instructions. Okay, check box, check that one off, right? And then it leaves, right? Same thing. So pretty cool. Then they have a trusted contact. If they add a trusted contact in here, you can add trusted contact, say your wife or husband. And then if two people have the app, they add each other as trusted contacts. And say the wife gets in a car accident, the husband has no idea what medications she's on because who knows, no husbands know that. He can go in here and say emergency view and see what are her conditions, what are her medications, and what are the last few visits that she's had. So then they could show that to the healthcare provider, right? So sort of like their own EHR, sort of, right? So yeah, I think those are the main features. I think we're always looking to make it better, and we're working with residents specifically because I think you guys are the boots on the ground and you know what's going on and how to make things better. So always looking to do that. Thank you guys for checking it out, and yeah, download it. Let me know what you think. You have any issues, suggestions, how we can make it better. We're always all ears. So thank you so much.